So now I'm pleased to welcome Dr. Shira Zelber-Sagi, Dr. Jonathan Stein, who will both be speaking in a session titled Lifestyle Recommendations, Pearls for a Busy Primary Care Practice. And let me just give you a more formal introduction. Um, so, Shira, we've known each other a long time. You're a clinical dietitian, but also an epidemiologist and renowned researcher specializing in nutritional and lifestyle epidemiology, chronic disease prevention, and public health. And you've been the head of the School of Public Health at the University of Haifa and serve on the Department of Gastroenterology at Tel Aviv Medical Center. You're a member of Israel's National Committee for Nutrition, Gastroenterology, and Liver Disease and joined the EASL governing board as the public health counselor in 2024, which we've all been benefiting greatly from. You've published over 150 papers on lifestyle factors and liver disease, including some of really the most thoughtful, I think, and important pieces of work in transitioning from the research more to the implementation realm. So welcome, Shira and Jonathan. As you know, you are a transplant hepatologist, clinical professor of, excuse me, of medicine at Penn State Health. Although you recently had a job change, you're an internationally recognized expert in MASLD. You've also authored well over 100 peer-reviewed publications, including multinational consensus guidelines. You've lectured widely in the US and Europe. I've always enjoyed listening to your talks, and now I welcome both of you to take the floor. You have 10 minutes each, and then we're going to try and reserve, 5-10 minutes for some discussion. So over to you.
Thank you so much, Jeff, for the kind introduction. We have a long-standing partnership and friendship, so thank you, and thanks to Mike for the invitation to speak here today. I'm so happy that I get to give my talk right after the patient representatives discussion, which was fascinating and is really well connected with what John and I are going to present right now, I think. So let me share my presentation. Okay, I guess you can see it, right? You see the presentation? Okay, thank you so much.
Yes, we see the presentation, we see it in full view, and I'll ask, yep.
Thank you, great. So I have the great challenge to cover a lot of topics in 10 minutes. Okay, let's go. So there is a very good agreement globally of what should be done to treat patients with MASLD. Here is the example of the EASL, ISAD, and ISO guidelines and ASLD guidelines, the most recent ones. And we can see that there is agreement that we should achieve weight reduction of at least 5% to get a remission of steatosis and a greater weight reduction to achieve a remission of MASH and fibrosis, more towards 10% reduction. There is a big agreement on the dietary composition, which is important by itself, not just weight reduction, but also the diet quality. And we hear a lot of discussion about Mediterranean type of diet, low sugar, low in saturated fat, a generally healthy diet. Of course, physical activity is important. I will let John to cover this topic. And some guidelines mention potential benefits of coffee consumption in reduction of fibrosis and liver cancer risk. And most importantly is that lifestyle is acknowledged as a good way to do prevention of liver disease and prevention of advanced liver disease, including fibrosis, advanced fibrosis, and even liver cancer. So when we treat the patients, we do treatment, but we also do prevention of liver-related complications, not to mention that we also do prevention of cardiovascular disease. And this is a global consensus recommendation document. Here we summarize 61 MASH guidelines and guidance documents published between 2018 and 2025 and agreed upon a Delphi process. And you can see again the same recommendations as we saw in the guidelines. And there is a great emphasis, as you can see below, on reduction of ultra-processed food. And this would be one of my main topics in my talk, because I think it's a very good practical tool that if you teach the patients how to recognize ultra-processed food, you can really help them to reduce a lot of calories, unhealthy fats, and sugar from their diet. So we talk a lot about the importance of diet in reduction of steatosis, but there is also importance of diet in reduction of fibrosis and fibrosis progression. And this is a huge study in the US with a very long-term follow-up, 15 years follow-up, 84,000 men with diagnosis of mast cell. And what they saw that during follow-up, that keeping kind of diet, kind of foods that are typical to Mediterranean diet help reduce fibrosis progression, while eating foods that are more related to Western dietary pattern, ultra-processed food dietary pattern, are related with increased fibrosis progression. And let's talk more about ultra-processed foods. So first of all, how do we recognize it? So usually it's a food that has underwent a very heavy industrial processing methods, nothing you do in your own kitchen. And therefore it has a long list of ingredients, usually more than 5 ingredients. And when you look at the list of ingredients, you won't recognize a lot of the things there because you just never use them in your own kitchen. It's only industrial products like the list you can see here. And it also contains a lot of cosmetic additives and coloring and all kind of fat like palm oil that you usually won't use in your kitchen. So that's one way to recognize it. The shape of ultra-processed food is very different from the original foods it was made from. It underwent such a heavy processing that you wouldn't recognize the original ingredients within this food. And just recently, a meta-analysis has shown that high consumption of ultra-processed food is related with 22% increased risk of having mast cell. This is a very nice study in the US national sample showing the consumption of ultra-processed food among adults, and there was also a section looking at adolescents in this study with the same results, but here I show only the adult population. And first of all, you can see what are the foods that are mostly consumed in the Western diet that are typically ultra-processed food. So you can see that almost half are actually sugar beverages. So 40% sugar beverages, this is 40% of the ultra-processed food consumption in the US. Then some ready-to-eat meals, frozen meals, then some breakfast cereals, then some packed sweets and snacks, and then ultra-processed meat, which has been shown in many studies to be related with increased risk of mast cell, then also hepatocellular carcinoma, and then some other types of foods. First of all, we now understand what are those ultra-processed foods in our diets, and then you can see that those with the highest consumption of ultra-processed food had significantly increased risk, 72% increased risk of having mast cell. This is also supported in a study of the UK Biobank, very large study, 9-year follow-up. And here they show an association not only with mast cell, but also with advanced liver disease. So high consumption of ultra-processed food was related with 43% increased risk of mast cell, 18% increased risk of fibrosis and cirrhosis, and 50% increased risk of having severe liver disease. And I had to show you this one, although it's not specific to mast cell, but just recently the Lancet published 3 papers discussing very deeply the issue of ultra-processed food, the health effects of ultra-processed food, and also the needed policy measures to reduce the consumption of ultra-processed food. And this is a summary of meta-analysis showing that ultra-processed food is related with increased risk of almost every chronic disease we know of, including cardiovascular disease and type 2 diabetes, which are highly relevant to people with mast cell. And a clinical trial recently has shown that if you provide people with a balanced, healthy diet but one diet is composed of minimally processed food and the other diet is composed of ultra-processed food, and you do a crossover study design and you provide those diets ad libitum for 8 weeks, then when people eat the ultra-processed food diet, they reduce some calories because it's a healthy diet, but they reduce less calories as compared to the time where they eat minimally processed food, meaning that minimally processed food leads to greater satiety and reduces the amount of calories eaten without a lot of effort because this is ad libitum consumption. So if we want our patients to succeed in weight reduction, we probably need to encourage them to eat minimally processed food diets. What about intermittent fasting? We were asked to be practical, so a lot of people use this method now. It's cool. I mean, many people find it very helpful. You stop eating, I don't know, at 5, 6, 7 in the evening, brush your teeth, and you decide, okay, I don't eat anything until a certain time in the morning, depending on your abilities and your daily schedule. But generally, intermittent fasting was shown to be beneficial, as good as any other low-calorie diet. So that means that intermittent fasting is another tool in the toolbox. If people who find it helpful to reduce calories, that's great, but the benefits are the same as low-calorie diet in terms of reduction of body weight, visceral fat, and liver fat. And what I want to show you in this conceptual figure that we wrote on a paper saying there is no one size fits all. So people really can choose low fat, low carb, Mediterranean diet, intermittent fasting, and you can also do mix and match. You can also mix those diets, and you can also be dynamic. You can also start with Mediterranean diet, and then the patient finds it boring. I don't know, you can change it with low carb diet. And then he finds it difficult to keep it, then you turn it to an intermittent fasting diet. So mix and match. You just need to listen to the patient, listen to their needs, and then change the diet and tailor it according to their specific needs at a specific time. The most important thing is that all diets should avoid high sugar, high fat, processed food products. And healthy lifestyle in general is important, not only the diet. So this study shows that if you combine together, create a score of no smoking, healthy weight, healthy diet, and doing regular physical activity, the more of these components that you manage to keep with, the lower is the risk of having muscle. There is a dose-response association between healthy lifestyle components and the risk of muscle. There's always the question, if a patient drinks a lot of alcohol, a significant amount of alcohol, is diet still relevant, or should we only focus on alcohol reduction? And the answer is the diet is relevant. Indeed, also among people who drink alcohol. So this study calculated a diet score that the more the score is high, the worse is the diet. It's more a kind of an ultra-processed food diet. And you can see the red line in this figure are people who drink significant amount of alcohol. But the worse is their diet, the worse is their risk to develop severe alcohol-related liver disease. And there was a significant interaction, as you can see in the bars, between bad diet and alcohol consumption in increasing the risk of severe liver disease. So even in people who drink alcohol, of course, we should reduce alcohol consumption, but in parallel, we should advise them to have a healthy diet and a healthy lifestyle. And this is also shown in this study. Mediterranean diet is protective from steatotic liver disease in general, but it is also protective specifically from MASLD and from alcohol-related liver disease. So yes, there is a significance for lifestyle also among people who drink alcohol. This is also shown in this study. People who exercise and have a healthy diet have the lowest risk to develop MASLD, this is obvious, but also have lower risk to develop meta-ALD. So just keeping in mind that alcohol consumption does not exclude the importance of lifestyle modification. And this study is the most interesting one published recently. It shows liver-related mortality. And it looks at lifestyle, and of course, lifestyle is a risk factor. Unhealthy lifestyle is a risk factor for liver-related mortality. However, what is really interesting is that physical activity and a healthy diet were protective also among people with heavy alcohol consumption and with significant binge drinking. So again, a healthy lifestyle is protective from liver mortality, even among people with 5 and 6 portions of alcohol per day. And we also should put an emphasis on sufficient protein consumption of patients with liver disease in general, and in Massfield, at least 1 gram per kilogram of body weight per day. What can be the healthy sources of protein? You can see in the figure here, lean meats, fish, egg, and low-fat dairy products. We have showed in a follow-up study of 7 years follow-up that constant consumption of low-fat dairy products is protective from muscle, while high-fat dairy products may be a risk factor. So they should choose around 5% fat dairy products, and it should be okay, and maybe even protective for muscle. And it's, as I said, it's a good source of protein. Importantly, everything I mentioned in my talk is also important for the prevention of cardiovascular disease or promotion of cardiometabolic health. Everything, the intermittent fasting, the Mediterranean diet, the avoidance of ultra-processed food, and so on. So just keep in mind that we also do prevention of cardiovascular disease with those recommendations. What should we talk about with the patients? So
Shira, I think you just went on mute.
how much did you miss?
Just like a 20 seconds.
Okay, so
But
just
you're
this
also
slide?
almost at the end of your time. So
Right, I know, but it's only this slide? Okay,
yes.
I'll continue here. What I really want to show you in this list that you can use when you meet your patient is, first of all, ask permission to discuss weight and diet with the patient. Ask permission. Can we discuss your diet? Can we discuss your physical activity? Ask permission. It changes. It changes the way the patient feels about the discussion. Then you can continue with this list of questions around their lifestyle. Ask open questions and don't criticize. And most importantly, provide a positive feedback on every single positive change that the patient does in their lifestyle. That approach is aimed to increase the self-efficacy of the patients and their motivation. So don't criticize, and of course, avoid stigma. And to avoid stigma, use a person-first language, as a beautiful paper Jeff has published, and also is incorporated into the EASL policy statement on stigma. And to reduce stigma, emphasize to the patient that it's not only his responsibility, that it's also genetics and environmental influence that affects what he eats and how much he can exercise.